connect, life can move in many ways. When our joints connect, our bodies move in many ways. And with so much movement in life, and especially in sports, sometimes our joints need replaced. The orthopedic and sports medicine experts of Trinity Health System are here to explain that to every champion, health matters.
Orthopedics is the study and treatment of musculoskeletal injuries, which means your muscles, your ligaments, your bones, your joints, including your spine. Orthopedic surgery in sports medicine usually involves minimally invasive surgery on the shoulder and the knee. Those are the most common joints that are injured. Those would be things such as arthroscopic surgery, which is just done through what's commonly known as keyhole surgery, in which we can reconstruct ligaments and cartilage and other damage in those joints. And for athletes, we talk about that technique for minimally invasive surgery so that they can recover and get back to sports as soon as possible. The most common joints are the knee and the shoulder. Of course, your hand, your elbow, your ankles also are commonly injured, but those would be the most common joints that are injured in sports-related activities, particularly team sports. We talk about fitness sports, running, cycling, then you get into more overuse type of injuries, and those tend to be in the legs, more in the hip and the knee, and as well as the ankle. So the most common surgical procedures we do on athletes, high school athletes, would be in the knee, which would be knee arthroscopy for things like ACL tears or ligament tears and cartilage tears in the knee, such as the meniscus. And in the shoulder in young people, one of the common things that happens is what's called labral tears or instability, where they dislocate the shoulder. The best way to prevent these is training, fitness and strength training. And particularly with ACL injuries, that's been shown to decrease the rate of injury. So in young athletes, balance training, strength training, fitness, endurance, all of those things help reduce the risk of ligament injuries in the knee. In the shoulder, those things help, but have not been shown to be as effective in preventing injury because a lot of shoulder injuries tend to be more like a trauma where someone is in a contact situation and they fall, or like in football, somebody hits them and that's when the injury happens. So it's a little more difficult to prevent those injuries. They tend to be just random from playing the sport. We're seeing more and more osteoarthritis, which is what people think about as degenerative arthritis. Generally, things you can do to try to prevent yourself from getting to surgery would be things like exercise, which is really, really important. And a lot of people struggle with that when their joints hurt because they feel they can't exercise because of the pain, but there are safe ways to exercise. And the take-home message is that exercise is good for arthritic joints. Moving the joint and using it is good for it, even if there's a problem such as degeneration. Other things that can help are medications. Weight loss is one of the most important things that can help. It's kind of like the load in your car and your tires. The less load the tire sees, the longer the tire will last. And that's the simplest way I explain it to patients. So weight loss can be very, very important in delaying the need for surgery. Can't necessarily prevent arthritis, but if you have arthritis, losing weight definitely helps. Some non-surgical treatments for sports medicine injuries include things like physical therapy and bracing. Medications sometimes can be used, and one of the newest things on the horizon now is platelet-rich plasma injections and what's called regenerative medicine, and we have a department that does that, and that's being done more and more to try to avoid surgical treatment and to try to help ligaments and other injuries heal without surgical treatment. When the pain is getting to the point where it's disabling you, you can't enjoy your life, you're in pain all the time, you have a lot of night pain. These are some of the warning signs that you may be getting closer to the point where you need to think about surgery and to talk to your doctor about it. But even if you think you're getting close to surgery, all of the things I mentioned should still be tried first, because although joint replacement is a great operation with great results, it should be viewed somewhat as a last resort. When you've tried everything else and you don't feel like you have a quality of life, then you may be getting to the point where you want to consider joint replacement surgery. Hip and knee replacements continue to undergo a big evolution, and the biggest thing that's going on now is what we would categorize as minimally invasive techniques, which means more rapid recovery and better pain management. there's been really a revolution in those two things in the last 10 to 15 years. So that people are having a lot less pain with the surgery, they're having a lot faster recovery, and they're having better results. With hip and knee replacements, often patients go home the next day or even the same day if they want to. And we find that their recovery period, while it's still pretty long, it's a lot faster than it used to be in the past because we've continued to refine our surgical techniques. That's why we really see more and more people undergoing the operation. We're becoming very successful at it, and so more and more people are choosing to have it because they want to improve their quality of life and their activity level. In knee replacements, there are just two general types we can talk about, and I do both of these. Depending on what the person needs, we can do what's called a total knee or complete knee replacement, which is the most common form of knee replacement. And this is an example of that. This is an example of a piece that goes on your thigh bone, a piece that goes on your leg bone, and the plastic that's in between. And the plastic becomes somewhat like your new joint, and you're bending your knee as such. Sometimes we don't have to replace the whole knee, and we can just replace half the knee, so to speak. And that's called a partial knee replacement. It looks much smaller, and this is what that looks like. So instead of the entire thigh bone being replaced, we just put a piece on part of it, and we put just half of the top of the leg bone. So in comparison, it almost looks somewhat like half of the total knee. The total knee replacing both sides, and in the partial knee, we're just replacing one side. In some people's arthritis, only one side of their knee wears out, and perhaps 5 to 10% of people are candidates for this procedure. The majority, at least 80 to 90%, need the total knee replacement. The hip joint is a ball and socket joint, so to speak, and it's the top of the thigh bone where it meets your pelvis. And in hip arthritis, the joint wears out and the ball rubs in the pelvis, so it becomes bone on bone. And how we replace it is we replace the socket with a metal socket with plastic inside. That becomes the socket side of the joint, and this piece goes down into your thigh bone, and that becomes your hip joint. So now instead of bone rubbing on bone, you have this joint that's flexible like this, and it's got plastic in there, which is like the new joint, and it gets rid of the pain. And that's what a total hip replacement looks like.
The orthopedic and sports medicine experts of Trinity Health System will be back next week. So stay tuned, stay connected, and stay on the field.